All right, everybody, let's get started. Welcome to From Spreadsheet to Sweatsheet, Sweat Street, Improving Policy Take-Up and Implementation in Scaling Programs. Our speaker for this session is Neela Saldanha. Neela is the Executive Director of the Yale Research Initiative on Innovation and Scale, also known as YRISE. YRISE is a research center focused on understanding how to scale development programs effectively. Neela has previously worked for an incredible range of research institutes, nonprofit organizations, and companies, and she recently co-authored a book called Marketplace Dignity, which is actually going to be published on Tuesday. If you have questions during the talk, please go into the Swap Card app, navigate to this talk, and there should be a Q&A function there. We'll collect questions during the session, and we'll have about 20 or 30 minutes for Q&A at the end. And now please welcome to the stage, Neela Saldanha.
Hello, everyone. It's nice to see people on a Saturday. I'm not sure I would have shown up for my own talk, so I guess thank you for showing up. Okay, so I have to thank Erin Crossett at GiveWell. So if there are any GiveWell folks here, tell her, she inspired the title of this talk. Which is when we think about development, when we think about effectiveness of programs, we're thinking about our spreadsheets, we're thinking about the calculations there. I want to take you to another element of what makes programs effective, which is literally sweat on the street. And I'll talk a little bit about that in terms of implementation. Okay, so if you can just go to the Streamalive chat, I just want to first understand what stage of your career you're in. If you're early career, 0 to 5 years, type in 1. If you're mid, 5 to 15 years, type in 2. If you're experienced, yes, you get it. And if you're a student, okay, we have a lot of early careers folks here, which is great, because I'm hoping to influence some of you to think about this. Okay, great. We also have some experienced folks, and it's a nice even mix of people. Did I do something? It's a nice even mix of people. So hopefully there's something here for everyone, and we can, start to think about what this might actually mean. And I just want to know, what would you like to learn from this session? Just type it into the chat, into the Streamalive chat. What would you like to take away from the session? What would you like to learn? What would you like to discuss? Frameworks, okay. Best practices, we can do some of that. Implementation challenges, lots of those. New perspectives, I'm not sure I'm going to offer many new perspectives. What should I scale? What should I not scale? That's a great question. How and when to scale? Biggest implementation challenges, realities on the ground. What are effective ways to get police to change? That's interesting. Maybe a discussion we can have later on. So a lot around how to know when to scale, how actually doing policy on a large scale, scalability considerations. Okay, reconfirming impact. Why not just give cash? That's a great question. And I was at Rory's talk yesterday. I'm completely convinced that that should be a standard that we actually look at. So yes, absolutely. Okay, so let me actually start not by talking about effective altruism or by talking about development interventions, but by taking you to a long, long time ago in a galaxy far, far away when I started my work experience. And I was fresh out of MBA school, and I actually started in the private sector. So I went to work for Nestle. And for those of you who don't know Nestle, it's the world's largest food and publicly traded food and beverage company. And just to put it in perspective how big these companies are, Nestle's revenue is $100 billion US. Okay, I understand the total aid in terms of official development assistance is about $200 billion. Okay, so Nestle is like 50% of official, and that's just Nestle. Then you have Unilever, you have Procter & Gamble, you have all these giant companies. It is $29 billion brands that by themselves sell $1 billion. And as you can tell, that led to, on the right-hand side, a very nice set of headquarters in Vevey, Switzerland, beautifully maintained with all of the profit and revenue that Nestle gets. That's not where I started my career. After a month of training, I was put into a sales district, a sales office in Mumbai, in a part. I grew up in Mumbai in India. It was a part of Mumbai I had never seen. And my job as an area sales officer was actually to go out with the distributor salesperson to cover some of those 12 million retail outlets that exist in India, and to make sure Nestle products were ordered by the distributor salesman. And those products were on the shelf. When advertising hits, consumers say they want to buy something, they go to the shop, and they actually see the product. And the reason I say this is because it really taught me about the importance of implementation, because despite the gigantic advertising budgets, like they could take over all of TV, and that's true of every single consumer packaged goods and many other manufacturers, sales was a really, really important part. They said if it's not on the shelf, it's not going to get sold. Okay, so that was a really important part, really taught me about the importance of implementation excellence, even if you have these brands that people love and they're going to buy anyway. Okay. Oh. Okay. So I want to talk about why is that important for effective altruism? So if you go to, I'm interested in global health and well-being, global development. So I went to the GiveWell site. And I looked to see where their big grants were. And this is an example of a big grant that they have. This is a grant, I think, for about 40 million. It's to evidence action for inline chlorination expansion in India. What is the grant about? Technical assistance. The grant will advocate for ILC's adoption, make it easy for the government to implement, provide additional staff capacity for budgeting, tendering, and running ILC programs. And only about 20% of this grant is actually procuring the inline chlorination. About 80% of the grant is for technical assistance, develop standard operating procedures, advocate for adoption, a lot to do with implementation. And this is true of any large grant that you're actually going to see. Very little of the grant is about the product. A lot of it is about implementation. So the question that you might ask is, well, does it matter? Right? If we get out this large grant and we have implementation effectiveness, does it actually matter? I love this paper by Noah Mangrist and Rachel Meager, which actually takes about 7 or 8, I think, educational interventions and looks to see what's the effect of implementation excellence. And what they actually find is that, and this is straight from the paper, results show that targeted instruction, that's the intervention they were looking at, which is delivering sort of targeted instructions in groups to students, depending on their learning level, shows gains of 0.42 standard deviations when taken up, and we'll talk about what that means, and 0.85 standard deviations when implemented with high fidelity. It is 10-fold higher than your typical educational intervention. And to put that in perspective, your typical educational intervention, I think, is like 0.1 standard deviation. So here we are thinking of great new ideas about how to get 0.1 standard deviation when we could be thinking about what we can do to improve implementation effectiveness to get 10 times that kind of return. So hopefully my advocacy is about, if we want to call ourselves effective altruists, we ought to think about implementation excellence and improving the implementation of our programs and the policy take-up of our programs, rather than just focusing upon what's the most novel, the most innovative, the most effective pilot program we can actually run. Okay, so this is not all we do at YRISE. Ours is a research center. So many of you asked about, scaling and when to scale, and that's exactly what we study. It was started by Mushfiq Mubarak, and the idea is that there's a lot. We've had the credibility revolution. We've had randomized controlled trials. We declare victory too early. We get the results of a pilot study. We just scale it up, right? And then effects are not quite what they should be at scale, complications arise. So the entire mission of YRISE, and I'm happy to talk about it at length in the office hours, we won't go through all of these circles because that would be more than the half an hour that I'm going to talk to you, and certainly don't want to take over this entire EA conference. But you can think about some of these effects. So there are political economy effects. When programs are very small, they fly under the radar of the government. The NGO does it, governments say, great, NGO's doing it, when programs become very large, you might have, it'll change the behavior of political actors. They might co-opt the programs. They might change those programs. Depends on what the electorate wants. So there are political economy constraints. Of course, there's evidence aggregation and external validity, and I talk a little bit about that in the policy implementation as well, which is if something worked in one place, does it actually work in another place? What's the effect of sample variation versus the effect of actual implementation? There's some work that's been done on spillovers and general equilibrium effects. If it's run in small scale, if it's run at a country level, if you're training entrepreneurs at small scale, you'll see differences between those who are trained and those who are not trained. But once you train all entrepreneurs, then suddenly that difference might go away, and so the effects of your program might be reduced. There's an interesting new area of combining macro development with microdata to answer some questions that sometimes microdata can't answer. What's the effect of trade? What's the or large investments? What's the effect of electricity? Does electricity increase household consumption levels? Does it increase firm profits? And then what I'll talk about today, which is policy implementation and institutional capacity. So at YRISE, we're really looking at all of these complexities of scale by running sort of large multi-site studies and having collaborations with large-scale organizations. So we have a partnership with BRAC, for example, which is, I think, the world's largest NGO. So I'll talk a little bit about the policy implementation and institutional capacity. And I'll talk about three things, I think, when we talk about implementation. First is we need to make sure that policy is actually taken up. We have the evidence, and we need to make sure someone actually says, yes, this is a program worth taking up. The second is what I'll call program coverage, which is just making sure the program runs the way that we thought the program would run. And the third is implementation fidelity. Did the program run in the way that we conceived of it originally? And one of the difficulties I actually encountered when doing this or thinking through this is there's not a lot of vocabulary around implementation. So when you say take up, people often think of different things. They think of coverage, they think of fidelity. Fidelity itself is not well defined in the literature, and that's one of the challenges of actually improving implementation effectiveness. We don't have clear concepts or any of this. So this is my vocabulary, and so that's something that just keep in mind. It's not, you might use different terms for some of this. Okay, so first we'll talk about policy take-up. Do policymakers actually embed the program in their organizations? Typically, if you want really large scale-ups, that's eventually going to be the government, whether it's a city government, a local government, a state government. Occasionally, you might have a scale-up through an extremely large organization, but eventually it is going to be some sort of government actor, okay? And let me ask you something. So here's some of you might know this paper. Researchers, this was in the US, but researchers actually analyzed 73 randomized controlled trials within 67 city departments. In how many cases do you think the city departments adopted a nudge treat? So this was the nudge communications. They looked at all 73 RCTs, and then they looked to see how many the city departments actually adopted. What's your guess? Do you think that they adopted it in less than 10% of cases, about 25% of cases, 75, 50, or all 100% of cases? Okay, just take a guess. Okay, people are, it's good. I think it's good. People are pretty pessimistic, because I think, like yesterday at Rory's talk, everyone was optimistic, including me, don't tell him that, about how much we had reduced poverty. In this case, I think we're pessimistic, but it's good, which is the answer is only about 25% of nudges were adopted post-trial, right? So first of all, there's that leakage, which is we might do a lot of studies, and only about 25% of those might actually be adopted. Now, you might say to me, of course, 25% would have been adopted because maybe the others really didn't have evidence, or the evidence didn't support it, so that's perfectly rational. We wouldn't expect 100% of studies to be adopted. What I found, and a lot of what I'm telling you is stuff that I read and it blows my mind. What I found is that there is what they found, which I found so amazing, is there's surprisingly limited support for the role of evidence in adoption. The yellow is my sort of highlights. We find no difference in adoption amongst results with negative point estimates. 25% of those were adopted by the policymakers. Results with positive but not statistically significant estimates, 25% of those studies were adopted. And there was slightly higher adoption if you had positive and statistically significant results. So the strength of evidence is not necessarily the thing that policymakers might use to adopt. And we'll talk about what that might be. But certainly for me, my beliefs were a lot higher than 30%. I thought, sure, they'll adopt some studies that have no evidence, but surely they would adopt at least all of the studies that did have really good evidence. So that's the number one lesson, I think, when we think about. And so if you think about barriers, I think you can think about two sets of barriers. First is individual factors, and the second is organizational factors. Policymakers are people, right? When we say policymakers, we don't have a clear idea because it's such an abstract concept. They are people. It is the undersecretary in a government. It is the program person. It is the person who's been brought in for this particular program. And so as all people, they have, like we do, everybody has certain heuristics or shortcuts, certain biases. So that's one factor that is a barrier or could be a facilitator to policy take-up or evidence take-up. But the second thing is policymakers work, as any decision maker works in an organization, and there might be organizational constraints to take up, which we'll talk about. Okay? So individual factors, really interesting study, where this was, I think, done with World Bank professionals. So in the bottom of the slide, and the next slide I'm going to show you, the data are identical, okay, identical. The only difference is one group is told this is data about skin cream. These are policy professionals in the World Bank. They're asked to say, which statement people who use the skin cream were likely to get better or likely to get worse. So which conclusion is best supported by the data, okay? And in the second group, they are told that this is data about minimum wage. It's data about a policy. So in one group, it's data about a neutral domain. In another group, it's data about a policy domain. What they find with the identical data, the same policy professionals, they're far more accurate when talking about the neutral domain. When it's the ideologically charged domain, which is minimum wage, they tend to interpret the data in line with their prior beliefs. Okay, so again, just hammering home the point that the data are not everything. They are subject to confirmation biases, even if you are a highly trained professional who looks at the data. And what do you think that policymakers, I've told you a little bit of taking into consideration. What do you think that policymakers take into consideration from your experience of dealing with these decision makers or reading about what this might be? What do you think that policymakers might take into consideration? They're certainly not just looking only at the evidence. Oh, sorry. What might be some, I'm just curious, some of this might be the cost to them, how it impacts the next budget cycle. Optics, yes. Government priorities. Institution incentives, we'll talk a little bit about that. Funding, which is somewhat of related to incentives. Political commitments, yes. Short-term costs. So I'm also hoping that this is a session in which I learn something from all of you. So I would love for you to come after office hours and chat to me, particularly if you have experience with some of this, where policymakers, for example, have looked at political benefits. I'd be very curious to learn more about that. Familiarity, yes, familiarity, and we'll talk actually a little bit about that. Their career development, yes. Costs. So yes, they look at costs. Another really interesting point, and I think of relevance to folks who are running programs in countries, This is a nice study by Vivolt and co-authors in which they look at how policymakers weight evidence. Okay, so what's the kind of evidence they look at? Is it the effect size? Is it the type of evidence, observational, quasi-experimental, experimental? Is it where the study was conducted? It could be conducted in the same country. It could be conducted in the same region, but a different country. It could be conducted in a completely different country. Whether it was recommended by a local expert, and how precise are the effects, whether the confidence intervals are low. What they actually find is that so policymakers are government folks. Policy practitioners, you can think about as sort of World Bank type people who provide assistance, technical assistance to the government. So of course, both look at impact in this case, they find, that they do look at the effect size, but the government, the policy makers are less likely to look at confidence intervals. So they're more likely to just look at the absolute impact, whereas the practitioners obviously are more likely to look at that. What's really interesting is that the policymakers, you'll see, does not really distinguish between type of study, whether it's experimental. And the reason I say that is we talk so much about gold standard RCTs and causal studies, and that's really not what policymakers are taking into consideration. What they do take into consideration is, was the study done in the same country? So external validity, not internal validity. Was the study done in the same country, and is it recommended by a local expert? And by the way, like the World Bank practitioners also look at that. So there is some functional information to being recommended by a local expert. What that's really important is, many of us come from institutions in the West. We're doing our RCTs, and then we're going straight to India or to Kenya or wherever and implementing. We're missing that link between who are the local policy, who are the local experts in the country who can sort of validate or help to present my study to the policymakers. And I think that's something that's really important to keep in mind when we're trying to get local policymakers. Yes, they would love a study from Yale University, but if Yale goes straight in there, it might be less effective than if we have partnerships with local institutions that can actually talk about the study. Okay, and this is, not really that surprising. So this is just an interesting chart about the Indian Administrative Service, which is sort of the civil bureaucracy in India. Highly, highly competitive civil services exam for people to get through. But you will see that most people are trained in the humanities, some in sciences and engineering. In other words, everyone isn't a PhD in economics and looking at data the way that we think that, people should be familiar with the data. So imagine the civil servant person who is really trying to get this information and doing that. And there is evidence from Pakistan that shows if you train policymakers in sort of econometrics, and they actually train them by using, I think, mostly harmless econometrics, they are more likely to privilege that kind of information. They are more likely to ask for that, and they are more likely to look at the evidence when they are making a decision about whether to implement a program or not. They're actually twice as likely to do that when their prior estimate is extremely low and they see evidence, in this case deworming, that the effects are larger than what they thought. So there is a way for us, but we need to build that capacity, and we need to train policymakers and use local experts if we are talking about implementation, getting our evidence out there. The second, so I've talked a lot about the policymaker themselves, their training, their biases, who they listen to. Another really important part is organizational factors, okay, which is inertia and processes. And people talked a little bit about budget, how do policymakers make decisions. So coming back to, remember I told you about the fact in the trial that only 27% of nudges actually got implemented, and it wasn't the strength of evidence, right? They were just as likely to get implemented if they had low evidence as strong evidence. So what was it? So the researchers actually found it was the strongest predictor of adoption is whether the city was already sending out that communication. In other words, if the city was sending out an email, say about garbage collection, and you said, let me make this a more behaviorally informed email, the city was likely to take that up. On the other hand, if you went to the city government and they said, help us to have more people put out their bins at night, And right now we're sending out posters, and you said, actually, the best way to reach people is through an email. Here's an amazing study we did. Here's a behaviorally informed email. If you change the mode of communication, no matter what the results said, they wouldn't actually adopt this. Okay, so more than, it's really important to understand the touch points that currently exist in the business or in the organization when you're proposing something. Oh, I have only 5 minutes, sorry. So I'm just going to skip through a few things. I'm just going to say that a little anecdote when I was at an organization and I was trying to get, and this is a private sector organization, I was trying to get an innovation in, which is behavioral sciences, into the organization. People loved it, talked to everyone. And then I sat with a VP of the vice president of the business, and I was telling her all about this, so excited, and she said, that's great. So is it in the strategic plan? And I said, what? And she said, is it in the annual plan? The planning process had just finished. This was March, and the planning process finishes in Feb of that year. And I said, no. And she said, well, if it's not in the plan, it's not going to happen. Where's the budget? Where's the people? And it was a really good lesson to me. Okay, if you want something to happen, if you're an implementer, understand how the government budget process works. Understand under what line item this is going to fall into, and you have a better chance. And another thing that we did during the mask trial is that often you talk to government and they say, this is great, which they did during this large-scale community masking trial, but then they have no weight. They say, we'll start it, but we'll start it tomorrow or next week. Today we're really busy. And so what we did is we created an implementation toolkit. We put the process, we put the stimulus, the training, the materials, we put the script. When we talked to the Gujarat government, we translated that into Gujarati for them. When we talked to the West Bengal government, and we just tried to remove some of that organizational inertia. Okay? So that's the first part. The second is, does the program cover the intended people? So now your policy has been taken up. Does the program actually cover people? I just want to talk about two important things, which is also about fidelity. So the first is, when you scale a program, you think about increasing the number of people, and we think that that will get us faster results or better results. We underestimate that as team size increases, there is coordination time. Okay, and this has been found in the lab. And as the team size increases, we do think it will take longer, but we underestimate how much longer because of coordination. So this is the team scaling fallacy. And therefore, a lot of our projects, when we scale them from 4 people to 40 people, we completely underestimate the coordination between all those 40 people, and as a result of which projects often don't run on time and budget. And just one thing to say about monitoring, I'm sure this is something you're good at. Keep it to a page. Okay, keep it to a page and don't use computers initially. Try to use handwritten sort of metrics because, and this is from a large private sector company. It's a multi-billion-dollar private sector company. And for one of their massive businesses, they just have 4 key indicators. How many impressions? This is for some credit card. How many applications? What was the approval rate? And what was the acquisitions? There's a ton of more information they can get, but that's what they see on a weekly basis. So that's my only sort of advice to you, which is do it without data, do it without computers, get people to fill in your one-pager, and then link it up to your data systems, because that way you're going to be really sure about what information you need, and you can actually monitor and take in on a weekly basis. Okay? The final thing I'll just talk about very briefly is implementation fidelity. Is the program actually working the way it was intended to at scale? And very briefly, this is how YRISE started. In Bangladesh, there's a lean season, and in the lean season, people they don't have an income. It's just before harvest. Now, the trouble is people actually live near cities which can offer temporary employment. So why don't people migrate? There seems to be some spatial friction. And so Mushfiq and his co-authors ran the study in which they gave people about $11.50. That was enough to just get a round-trip bus fare and food in nearby cities. What they actually find is that results are very promising. Some of you might have read this. Migration went up. Importantly, people, their families back home got to consume almost 500 calories per person per day more, and it was sustainable. People migrated. But then they scaled it up, and amongst other problems, the effects went away. And what happened? The program depends on the group of people who would not have migrated, and you offer them this program. Okay, that's what the effect depends on. You hand it over to an NGO. The incentive of the NGO is A, to hand out loans. You tell them you have to hand out X number of loans. They have capacity constraints. They are going to hand out loans to people who are just most interested. In this case, the most interested people were the people who were thinking of migrating anyway, and they said, oh, here's $11 for me to do that. Let me do that and do it. So I think it's really important to think about incentives. It's important to think about delivery mode. I'll just talk about the top study, which is early childhood intervention. You have care workers who go to the household to tell parents how to play with their kids, what to do. Very expensive. So one way that people were thinking about it in Uttarakhand in India was instead of having the person do it digitally. So a series of 10 calls that were made to the parents with exactly the same material as would have been presented by the community health worker. And all the effects went away. In fact, they were slightly negative. Maternal anxiety increased. There was no effect on child development. Nothing. And just by changing the delivery mode. What happened, number of reasons, one of those were, they think, is that instead of visiting regularly, and they actually compared it with another phone intervention program that worked in Guatemala, is that instead of doing it regularly, they allowed parents to pick when they would call, which meant that maybe a long time went by before parents sort of said, oh, now I have the time to receive this phone call. And there were a number of other considerations. I'll just say one thing. I worked in a design center at Pepsi. One thing the designer told me, that a solution with constraints is a new solution. It's not a solution with constraints. So when you say my intervention is this, and I'm just going to change the delivery mode, it's a different intervention. It's not the same intervention. That's just something to keep in mind. One more really interesting thing, we do not collect data on this normally in our papers. You're asking community health workers to run your intervention. What are they not running instead? Okay, they are going to make choices about what they're running and not running. And they show this in Bangladesh, where they embed early childhood services into the National Nutrition Services. Workers substitute away from some other program to this program. Now, in this case, that substitution was a good thing because actually outcomes improved, both for the nutrition program as well as for early childhood development. But in other cases, it's shown to crowd out. Okay, so that's really something. I'll end with this point on, should we be thinking about scaling the organization or scaling the solution? In our in development, we often think about scaling as making our organizations larger, hiring more people. If we said we need to scale the solution, we might borrow models such as, for example, the franchise model in the private sector, where Pepsi and McDonald's and Marriott and Honda do not own any land. They don't run their own shops. They run franchise operations. They take a percentage, they set operating terms, very strong agreements with partners. Sometimes it's very stringent, like with McDonald's, so you get exactly the same thing in every store. Sometimes it's much more variable. This hotel is probably run with a franchise agreement where the owner can run the business as they see fit within certain brand guidelines by Hilton. I don't see a lot of examples of a franchise agreement in our sector. It's often just, we have to do it with our own organization. And so I think what we need to do if we think about scaling solutions is, should we be looking at new research and collaboration? What are the incentives in academic research to publish, not a lot, on implementation effectiveness? So should we be thinking about that? And for those who are like the donors in the room here or going to be talking to them, I think we ought to be thinking about new funding mechanisms. Right now, we do have a few big bet funders, but they're very few and far between. We have nothing like a Series A, B, C, D funding before you hit IPO. So typically, we are doing pilot, friends and family funding, and maybe Series A, going straight to IPO. We really don't have ways that people are funding these complexities of scaling. So we need to rethink that if we're going to really be serious about scaling and think about implementation complexities of that. So I'm just going to end, and I'm done. We can have the discussion. Did you take away anything from the session? You can say no, I didn't have anything. Just curious to know what you took away from this session, if anything. Yeah. Evidence is not everything. Scaling is hard, yes. It's very worthwhile, but it's not as simple as fidelity, personnel time allotment. We're actually doing some studies, I can talk about that, in which we are looking at that time allotment for a mental health program that we're trying to run in Bangladesh, embedding it into the primary healthcare system. So that's a big part, like what are the healthcare professionals? Partner up for scaling success, I think, that's a great point. It's harder than we think. Because like I said, what is the sort of franchise agreement? What's the partner? What do they do? What's the standardization? What's the flexibility? So yeah, if someone's interested in studying franchising with me, please sort of contact me after that. We could study this and see what we can do about it. More creative about business models. That's essentially like one of the key ideas I think that we want to get there. Need to be trained to make the right decisions, yes. So I hope that was useful. That's my email. I'd love to hear from you, particularly your stories of scaling something or your thoughts or your questions, because I think it's really important for us to jointly build some sort of intelligence around effective scaling. Thank you.